let's bring in our guest, Dr. Marty Makary, Food and Drug Administration Commissioner, Secretary Robert F. Kennedy, Jr., Dr. Mehmet Oz, Administrator for the Centers for Medicare and Medicaid Services, and National Institutes of Health Director Dr. J. Bhattacharya. Thank you all for being here. Mr. Secretary, this is unique in that you work with all these guys very closely, and it's a different scenario for HHS.
Yeah, I actually had Tommy Thompson in this morning talking to me, who is the HHS who had my job under the Bush administration, and I was talking about my relationship with these gentlemen who are running the agency, running the major sub-agencies of HHS, and he said that nothing like that had ever happened in history. I say that I talk to them typically about 2 or 3 times a day. We're friends, we go to lunch together, we stay at each other's homes, we vacation together, and then, you know, we're aligned on, in our vision. Friendship is based upon shared values, and that's the strongest bond that holds people together. And in this, we all share a vision that's been a lifelong vision for all of us, which is to make our country healthy, to have evidence-based science, to have gold standard replicable science, and then use that to challenge what we have, this kind of bedrock system that is destroying our health, which is a complete misalignment of economic incentives and public health. Yesterday we met with the heads of all the biggest pharmaceutical companies, and I said, I want to live in a place where you can make money by making people healthy. And right now we're all aligned against each other. The healthcare system in this country is a bundle of perverse incentives that force people to do the wrong thing. And we've turned this country into a sick care system rather than a health care system. And all these people are the people who are going to change that.
I know you all have a lot of balls in the air, but I'd love to go down the row and just talk about the big thing that each of you are dealing with, working on. First, FDA. Marty?
Well, first of all, we want to focus the agency on cures and meaningful treatments. In the last administration, the #1 priority the commissioner stated was fighting misinformation, and the DEI staff ballooned out. We want to focus on cures and meaningful treatments. We believe in the letter and the spirit of right to try, and there's amazing stuff in the pipeline I've seen. We're talking about new treatments for stage 4 cancers, for neurodegenerative disorders, for diabetes that we've never seen before. Why does it take 10 years on average for drugs to come to market? Why are we blaming children for being sick and not looking at our food supply? Why are we thinking it's a willpower problem as we watch half of our nation's children with belly pain or attention deficit disorder on medications? And can we use common sense and gold standard science both? And that's the charge that we have from Secretary Kennedy.
You've also obviously done the dyes recently, and we covered that extensively. There's this question about vapes coming over from China, and that they're really pervasive in our country, and kids with like video games and getting vapes, and they're dangerous. That falls under FDA.
Yeah, it does. These are devices that are designed to get kids addictive to playing a video game, and there's an inhalation port in the device. They're showing up at our borders, and what we have been doing is just sending them back. And so the Chinese manufacturers are just sending it to another port. It's called port shopping, and they all get in. They're laughing at us. So that's going to stop in this administration. We're not going to allow these devices to get in. We're going to confiscate them.
Mehmet, there's a lot of focus on Medicaid and Medicare, and it gets demagogued all the time, that you're coming after it, that you're going to kill it, that you're going to cut it. What do you say to all that?
Our goal is to put health back in Health and Human Services. And under Secretary Kennedy, and that's why we're all here, we're laser focused on the broader picture, the more holistic picture. In the back of this wonderful theater that we're recording in now, there's a quote from Hubert Humphrey. The building's named after him. He's a Democrat. And he said it's the moral obligation of government to take care of those of us at the very dawn of our lives, children, at the twilight of our life, the elderly, and those living in the shadows. That's our focus. It's quality of care at all levels, and we're working together to make sure that happens. In every single scenario that we're looking at, we're increasing payment in Medicaid, putting more money in the Medicaid.
Increasing.
Increasing. So the question is, how do you spend that money so efficiently that you stop throwing money at problems, but actually deal with the broader health needs? addressing the fundamental reality that 70% of the money that CMS spends, that's on Medicare, Medicaid, the exchanges, CHIP, 70% of the money we spend is on chronic illness. And we're not getting our money's worth. So for folks listening right now, it's your patriotic duty to be as healthy as you can, and it's our job to help you get there, make it easy to do the right things. At the same time, we've got to make wise decisions because we're stewards who have to protect the money for the population that Hubert Humphrey described.
Fiscal year 2024, largest percentage of improper payments, $54 billion Medicare, $31 billion Medicaid. Earned income tax credit was 15, SNAP was 10.5, but I mean, you're looking at 5 million in improper payments?
Billion.
Billion. That's an underestimate.
Yeah. Here's the thing. We have a war room now, a war room to fight back against adversaries. And these aren't just small-time players. These are foreign governments, weaponized organized crime. And why are they coming after us? Because our budget is nearly $2 trillion if you include the monies that are spent that we direct but sometimes don't come out of our pocketbooks. But the direct budget just for CMS is $1.75 trillion. That's twice the defense budget. So there's a big target on our back and folks are coming after it. And they're the kinds of things that should make you mad. It's USAID on steroids, frankly. But I'll give you a couple examples. Almost 250,000 Americans found out by surprise because they got an IRS notice that they had gotten the Affordable Care Act insurance without knowing it. Why would you sign someone up without telling them they have insurance? Because brokers can steal the money. We have hundreds of millions of dollars spent on housekeeping. We have tens of millions of dollars spent on public unions getting free child care or student tuition or DEI programs. I have an obligation, all of us do, to protect the people that Humphrey was speaking about. And if we're not going to protect the most vulnerable, that's who they're stealing money from, then we're not doing our job. So we're going after, there's a new sheriff in town, and we're coming after folks in a very big way.
NIH, always looking to the next thing, but there are people concerned that funding is drying up. In the president's budget, FDA is spared, but there's $33.3 billion cut from HHS, $18 billion from NIH, $674 million from CMS. Does that affect you, and how do you portray that about what NIH is doing?
I mean, I think the key fact I look at for NIH is that the mission of the NIH is supposed to do research that improves the health and longevity of the American people. And since 2012, we've seen no increase in life expectancy in this country. In that sense, the NIH has not done its mission over the last dozen years. And in fact, NIH was involved in supporting research that may have actually led to the pandemic that we all just went through. So we'll
speak to that for a second. Gain of function, just signed this executive order the other day in the Oval Office. What does that mean to the average person? You can stop it on the U.S. side, but obviously it's happening around the world.
The U.S. is the primary state that sets the example for how to do this kind of work around the world. When the U.S. says, look, we're not going to allow scientists to play God, take viruses with cockamamie justifications, make them more transmissible, more deadly, that doesn't protect us against anybody, and it causes tremendous risk. And what the president did by signing this order is he said no more. We're not going to have another lab-generated pandemic on my watch.
The Surgeon General nominee was supposed to be a hearing today on Capitol Hill. Dr. Neshwat was pulled. She's heading here to the HHS. What happened with all that?
What happened with her withdrawal? We talked to Dr. Neshwat. We're going to put her at a very good place here at HHS. Casey Means, we felt, was the best person to really bring the vision of MAHA to the American public. She has this unique capacity to articulate it. She's written a book that really mobilized, galvanized the movement. She is an extraordinary, she is excellence in everything that she's ever endeavored.
Obviously, she's come under her own criticism about some of the things she's advocated for. She never finished her residency, and she doesn't currently have an active medical license, but that's not...
She was the very top of her medical class at Stanford. She's during her residency, she won every award that she could win. She walked away from traditional medicine because she was not curing patients. She couldn't get anybody within her profession to look at the nutrition contributions to illness. And she said, if we're really going to heal people, if we're healers, we can't just be making our life about building new procedures. We actually have to figure out new approaches to medicine. And that's the kind of leadership that she's going to bring to our country.
And last thing on this, your former running mate weighed in today saying that she wasn't happy about this and said that you're somehow being controlled. Your decisions are being controlled. That's what she posted.
Listen, you guys sitting here, 4 people who were all canceled during COVID.
Yeah,
Right.
Of these people are, you've got the entire leadership of this agency is renegades who are juggernauts against convention and who are trying to look for truth no matter what the cost.
So nobody's controlling your
Casey
decision.
is among those.
Gentlemen, stand by if you would. We'll be right back to the HHS department after this. Welcome back to the HHS department. We are talking MAHA with the leaders of the health movement at HHS. Mr. Secretary, estimated 129 million people in the U.S. have at least one major chronic disease. 5 of the top 10 leading causes of death in the U.S. are or strongly associated with chronic diseases. If you go down these stats as we put them up, we're not healthy as a country. 100 days in, do we have a sense more of why that is?
We're about to publish the MAHA Commission report, and that comes out next week, and that will summarize and distill the science that we have that points to causation. And in many, many cases, we know what the cause is. Too much sugar, too much starch, ultra-processed foods. When my uncle was president and I was a 10-year-old boy, Brent, the chronic disease rate in our country was 3%. Today, it's around 60% in kids. Juvenile diabetes was practically unknown. Today, 38% of American teens are diabetic or pre-diabetic. Autism in 1970 was the most comprehensive and largest epidemiological study ever done was done in this country to determine precisely how many kids had autism. At that time, it was less than 1 in 10,000. Today, CDC's data that we released last week, 1 in 31. In California, it's 1 in every 20 children, 1 in every 12.5 boys. This is 1,000 times worse than COVID, this epidemic. And nobody's done anything to adjust, even to try to identify what the etiology, what the causes are. We're doing that. Jay is doing that now. We will know these answers very quickly.
How soon do you think?
Well,
Because that's a big thing for a lot of parents.
We will have definitive answers within a year, but we will have very good answers within 6 months, by September. So we'll have preliminary answers by them from some of these early studies. We will have definitive answers within a year. But some of the stuff we don't need any more science. We don't need more commissions. We don't need more study groups. We need to act. We need to reduce the amount of sugar in our food. We need to reduce the amount of chemicals. We've already ordered that all the dyes, the 9 petroleum-based synthetic dyes, we're getting rid of within 2 years, the worst 2 within 2 months. So we're acting in this administration, and we're going to identify the things that we can't get rid of. We're going to label so that when you go into the grocery store to buy food for your children, you know what you're giving them, and you know whether it's going to be good for them or whether it's a food-like substance that is loaded with lab-created chemicals that's going to poison your children.
All of you have now been in the belly of the beast now for a little bit. Breaking or changing a bureaucracy is a massive thing. Right? I mean, it's hard.
It's hard, but we're up for hard work. And I think one big surprise I had that I didn't expect was just how the incredible chemistry that we've developed as friends has enabled us to be very effective. For example, Jay and I launched a massive program to reduce animal testing, both in research and before drug approvals. Dr. Oz and I have been working on a way that Medicare can pay for something the second the FDA approves a breakthrough device, so they don't have to go through their own repeat duplicative approval process for a year. They're important issues. We got to debate, and we've got good solutions, but the health of the population is the core issue that we've not been talking about.
If we had another pandemic, would we do the same thing? Would it be completely different?
No.
Well, how would it be different?
We do science. We do evidence-based medicine. CDC knew how to do this, and WHO, they knew there were manuals on how to do it, but they just threw those manuals out of the window. And they did a politicized version of science that was designed to serve certain vested interests, economic interests and power centers in the society. And we had a complete information chaos. And that is good information is the basis of managing any pandemic. And we're going to make sure the next time that happens, that we have gold standard information. We have complete transparency so the public can ask us questions, and then we can make answers. And above all, we are going to get rid of the taboos about challenging orthodoxies, about challenging consensus. And we're telling the public every day, all of us, that is not science. You know, your whole industry was telling the public for years, trust the experts. Trust the experts is not a function of science or democracy. It's a function of totalitarianism and religion.
You testified on Capitol Hill that you're not anti-vaccine, but you do have concerns about mRNA, and you want to move forward with figuring out what that's going to look like in the future.
We're going to do peer-reviewed, we're going to do placebo-controlled studies on all new medications and all new technologies. That's what we should have been doing all along. We need to understand the risks and the benefits of these products, and we need to be, the American public cannot have informed consent, which is a key feature of democracy, if they don't have good knowledge about the risks and benefits of the products they're purchasing.
Dr. Bhattacharya, you want to weigh in on that?
Yeah, can I follow up on this? One of the main problems during the pandemic was censorship. Free speech is absolutely essential for scientific progress. Free speech, if we had it during the pandemic, we would have had much better outcomes. So when Secretary Kennedy says that we're going to have gold standard science, the bottom, what holds that up is free speech. And when Secretary Kennedy talks about the taboos in science, he's absolutely right. I as a scientist, I don't know what causes autism to rise. I read the scientific literature, and it just looks like people haven't really asked the question in a deep and honest way. What we're going to do is we're going to shatter that taboo so that people can ask the question honestly, so I could look at the scientific literature and give an answer that's grounded in truth. You saw during the pandemic, it was taboo to say certain things, right? You couldn't say that if you had COVID and recovered, you'd have some immunity, for instance. Those kind of taboos are anathema to scientific progress. And in this administration, under Secretary Kennedy's leadership and President Trump's leadership, we are not going to have those taboos. We're going to have free speech in science and free speech in medicine.
Gentlemen, stand by again if you would. We'll be right back with Special Report. To the HHS department, continuing our interview with the leaders of this effort. We're going to go down the row here. What's one thing for people sitting at home in the near future that you think from a health perspective they should focus on for what you all are doing? Because it's an uphill battle.
Well, I think this is something that most people don't know about, that the NIH has been doing. We've been working with Vice President Vance to look at a study of and to find answers for people affected in East Palestine by that train disaster that happened during the Biden administration. It was shockingly, the NIH had not asked that question. But what I'm looking forward to is that we're going to address the health questions and the health needs of the American people with excellent gold standard research.
It is your patriotic duty to be healthy. It's a hell of a lot more fun than being sick as well. And I say that because 3/4 of our youth cannot serve in the military because they don't pass fitness standards. And we've got a massive budget that is driven primarily because we're overweight. 43% of us overweight. That's more than twice what European countries can boast, and it's almost 10 times what Japan is. So we got to do this together.
We've believed in empowering patients with good information. And so one of the big barriers in health is that the government put out maybe one of the biggest pieces of misinformation in the history of healthcare, and that is a flawed food pyramid written by the industry. And so one of our tasks at the FDA that Secretary Kennedy has given us is to rewrite that guidance, and that MAHA report coming out soon is going to have a lot of the new information.
TV commercials, where are you on that?
We don't think, and I met with pharmaceutical companies yesterday and had a very frank discussion with them about ways to limit TV commercials. When you advertise a pharmaceutical product, it's the government that is most likely going to pay for that product. You're advertising products that people aren't going to pay for, but they're going to go buy it. And you get a tax deduction to put that ad on TV, so the federal taxpayer is paying for the, for the ad, then they're paying for the product. And we use 70% of the pharmaceutical products in the world are sold to our country. We only have 4.2% of the world's population. We are the sickest country in the world, and pharmaceutical products are the #3 cause of death after cancer and heart attacks. So all that advertising, we're the only nation in the world that allows that kind of advertising on TV. We're a complete outlier. There's one other country, New Zealand, that allows limited, but nothing like what we do.
But you've talked about environmental toxins before. You think it's a real problem?
If we are going to protect ourselves against chronic disease, we've got to find out the etiology, the origins of it, the environmental exposures that are causing it. And then we have to eliminate them. And that's what we're doing. And we can do it, and we're going to do it, and we're going to do it in 4 years.
Pretty amazing. Well, when you have all those breakthroughs that you're talking about, please come back and talk to us again. Thank you very much for your time.
Thank you, Bret.
Up next, Secretary Kennedy takes us for a behind-the-scenes tour of the HHS Operations Center. The Hubert H. Humphrey building was completed in 1976. It was actually first called the U.S. Department of Health, Education, and Welfare. In 1977, it was named for the former Vice President and Minnesota Senator. It's actually the first person to have a federal building named in his honor that was living at the time. 1979, they took the education part out. HHS has been here ever since. Special report continues after this. Tonight, a look inside the HHS Secretary's Operations Center with the man himself. All right, Mr. Secretary, this is the Operations Center?
Yeah, this is the Secretary's Incident Operations Center. And this is where we track, any kind of incident. It could be hurricanes, it could be chemical spills, it could be a measles outbreak, which is what they're tracking right now.
Let's go around this way. These are your guys at the...
How are you? Good to see you.
Welcome, sir. Good to see you.
Thank you. Thanks.
So any incidents that are happening real time, it's put up on the screens here.
Yeah, and it allows us to visualize it. And to, it helps us better to mobilize resources to whether it's a pandemic response team or whether it's chemical response or any kind of emergency, to look at the assets that we have in that area and get them to the site as quickly as we can.
So measles is at 980, I guess, confirmed cases.
Today. I'm very proud of CDC's management of the measles pandemic. It's in 22 states, but most of it's been in Texas and New Mexico. We're working with the governors at their request of both states. We have teams in both states doing epidemic response, but we have seen the growth in numbers steadily decline, and the seriousness of the cases also decline. If you look at our country, if you look on this map, we have about 940 cases. Canada, which has 1/8 of our population, has 1,100 cases. Europe has over 6,000 cases. They're twice our population, but they have 7 times the amount of cases that we do. And Mexico has pretty much the same amount we do. So the CDC has been doing an excellent job on the ground at getting this outbreak under control.
And so what's your message to the folks who are dealing with that, especially in Texas?
Well, you know, in Texas, a lot of the people who are affected are the Mennonites who are unvaccinated. And measles is going to spread through an unvaccinated population. We tell people you should get your vaccination because that's what's going to stop the measles outbreak. But we also understand that some people don't do that. The MMR vaccine that we currently use has millions of particles from were created from aborted fetal tissue, millions of DNA fragments, and there are people who have religious objections toward those, and those people should be treated with compassion. If they come to a hospital and they're sick, we need to know how to treat them. And one of the failures of the CDC in the past is they weren't telling doctors, no kid should die of measles in this country. Even in 1963, before the introduction of the vaccine, there were 400 deaths a year, and there were up to 2 million measles cases. So it's only very, very sick kids should die from measles, and nobody should.
There's some that were saying that the rubella portion of the vaccine, and you were talking about the produced from the fetal cell line, originated from an abortion that took place in the 60s. But the MMR vaccine doesn't contain the cells in its final form.
It doesn't contain cells, but it contains DNA fragments.
Got it. And so that's your point.
Yeah. So, and people have religious objections to that. And although I might not share those objections, I respect them. And I think those people, you know, a lot of the Mennonites told me, and I went down there and spent time with the community during the outbreak, and they said they didn't want to go to the hospital because they were treated as pariah. They said we were treated like lepers there. And that should not be part of American health care. If somebody comes in, if they have a religious objection, we should still be treating them.
And your big point is a choice for people to make informed choice.
Exactly. And that whatever your choice is, you're human, you're entitled to compassion, you're entitled to the best quality health care, and nobody should die of measles.
Let me ask you one more thing, not on these topics. Today, 60,000 more files came out about your dad's assassination. And there's obviously thousands of files about your uncle's. Do you think that has come out fast enough? Are you okay with what has happened, transpired with all of that?
I mean, I think President Trump has done an excellent job. This is stuff that was supposed to be released at the latest in 2018, and it was held year after year after year. And you know, the fact that he's finally releasing it, I think, gives us all a chance to have a new beginning in our country, because that was really a crossroad when our country sort of walked down the road that President Eisenhower had warned us about becoming an instrument of the military-industrial complex. And if we want to walk that back and reclaim America's initial ideals, it has to begin with total honesty.
Do you think we'll ever know? I mean, we're digging through these files today now, but do you think we're ever going to know on both cases?
We know a lot about my uncle's death, so that's been very well documented. There's probably 30, confessions. There are people who were involved in it. We know a lot less about my dad's death. There's all kinds of circumstantial evidence that there was U.S. government involvement. There's not the kind of proof that we have now with President Kennedy's death.
We'll keep looking. Mr. Secretary, we appreciate this day. Thanks for the tour.
Thanks for having me, Brett.
I appreciate it. Up next, some final thoughts from here at HHS, plus a big announcement.